Welcome to the Heal Podcast. I'm Kelly Noonan-Goris, and every week I speak to the leading doctors, healers, spiritual teachers, and scientists to find out what is truly possible when it comes to healing. I also interview real people with extraordinary healing stories. My philosophy is, what's possible for one is possible for all. And I've discovered on my journey that so much more is possible than we can begin to imagine. Hey, everybody, and welcome back to the Heal Podcast. Today, we're kind of expanding to include the animal kingdom. I'm so excited for this conversation. I have Dr. Gary Richter, who is DVM, Doctor of Veterinarian Medicine, with me today. Gary is a distinguished veterinarian, author of newly launched books, Longevity for Dogs and Longevity for Cats. He's an international best-selling author of The Ultimate Pet Health Guide and founder of Ultimate Pet Nutrition. Dr. Richter is certified in veterinary acupuncture and veterinary chiropractic, which I think is so fascinating. I cannot wait to talk about there. Dr. Richter understands the benefits of both conventional and holistic treatment methods, which is what this podcast is all about, how to take advantage of technology and science, but also stay as close to nature designed and intended for us as possible. So welcome to the show.
Thank you. I'm so happy to be here.
Yeah. So yes, for all the animal lovers, the animal companions out there, I think we're not allowed to say owners anymore. Have you heard that?
It depends on who you talk to, but yeah, a lot of people are going with pet parent these days.
Okay, pet parent. I love that. We'll
Yes.
go with that. I don't personally own pets at this. I'm sorry. I don't have pets. I'm not a pet parent at this moment.
You can use whatever term you want to use.
Yeah. But I did grow up with dogs and a 11-foot Burmese python that my father brought home at some point.
Okay.
So we can talk about that. But I would love to know, just first and foremost, why you got into veterinary medicine and the passion for animals in your life.
Yeah. I mean, I was literally one of those kids who was just always an animal person. Always have been. I've always been sort of drawn to animals, and I've also always kind of been a science geek. So it was sort of a natural progression for me to go that route. So I guess I'm one of those lucky people who sort of had a pretty good idea of the direction I was going from a very, very early stage.
Amazing. Yeah. And did you have pets as a child, or
not really?
No.
Ironically, no. No, we really didn't have pets as a child. My father was horrifically allergic to cats. Couldn't ever convince my parents to get a dog, so no, didn't grow up with pets.
All right, so that was your driving force. You're like,
I'm gonna be
with animals.
Yeah, for sure.
And I mean, just the holistic aspect is so fascinating, and so who knew that you could do chiropractic on animals? Can you explain what inspired learning that discipline as well, and how that even works? Like, how do you adjust a dog or a cat?
Sure. So I, like every other veterinarian, I went to vet school and learned conventional Western veterinary medicine, and I was out in practice for several years, and I kind of got to this place where I sort of got myself into a bit of a kind of a personal professional crisis, if you will, in the sense of, I think what a lot of people who are not in medicine don't realize is that a lot of practicing medicine is really following an algorithm. So if your patient has these symptoms, then you run this test, and based on those results, you may, do XYZ treatment-wise, and you kind of work your way down the algorithm. And the sort of the crisis that I got myself into is, after several years in practice, I was really able to see where the end of the algorithm was. And when I was going to run out of road from a treatment perspective. And what I never enjoyed doing, and what I still don't enjoy doing, is going to people and telling them there's nothing more that we can do. Take them home, keep them comfortable, and let me know when it's time to say goodbye. I hate that conversation. And it led me to start looking to see if there were other avenues, other things that I could do to help my patients. I had a kind of a brief brush with acupuncture when I was in vet school, so that was kind of the place for me to start. I did acupuncture training, and what I realized is when I started treating animals with acupuncture, I was getting further down the road, treatment-wise and results-wise than I was before. So acupuncture led to chiropractic. So then I got certified in chiropractic. And to answer your question, chiropractic adjustment is not dramatically different from what happens in people. It's a little bit less dramatic in the sense of like, there's very little by the way of like snap, crackle, pop.
Okay.
Like when we go to the chiropractor, you almost never hear that. So the mechanics of it are different because obviously their anatomy is different, but the philosophy is the same as you're putting motion back into joints that maybe are stuck. One of the things I learned when I learned chiropractic is as somebody, I've gone to a chiropractor for years, I had always thought of it as kind of like a very orthopedic discipline. And what I realized is chiropractic is really more about neurology than it is about orthopedics. So when you start looking at it through that lens, it becomes a very interesting modality to treat all kinds of things.
Because of the effect on the nervous system or getting the meridians in flow?
Yeah, because when you're moving joints, especially when you're talking about moving spinal joints, you are invariably affecting nerve function. And that's really sort of the basis of chiropractic is what you can do with the nervous system.
Wow. So let's now talk about longevity.
Yes.
And diet. I know that there are a lot of the questions that pet parents wrote in on social media, and then just friends that I have that have been cat owner or cat parents forever. There's just so much debate around food.
Yes.
What have you discovered is the best form of food? There's all these, especially in LA, there's like people feeding them real pure food. So just give us the overview of what you've learned and kind of the guidance you give. Sure.
The big picture is and this will come as no surprise to you, but the single greatest thing that anybody that can do to positively affect their own health is optimize their diet. And God knows in this country people do not eat well on the whole. And sadly, that is true for animals as well. The vast majority of animals that are out there are eating dry food, kibble, or canned food. And when you really look at it, there's no way to get around the fact that dry food and canned food is ultra processed food. And it has all the baggage that ultra processed food has for us. We all know that the more fresh whole food we eat, the healthier we tend to be. It is no different than with animals, but for some reason that is a real big disconnect, not only with a lot of pet parents, but sadly with most of the veterinary profession. And that to me is something that's very unfortunate, and that I'm not alone in this, but myself and a lot of holistic and integrative veterinarians have been working on educating people and veterinarians towards in general, because again, nobody evolved to eat processed food. Like that's not how our bodies are designed to work. So it stands to reason that if you put the right fuel in the body that the body was designed to thrive on, that they will do better. And lo and behold, it's true for animals as well. Mm-hmm.
And I mean, is it possible to change? Like if you're just coming into this awareness, and I don't know if it's a cost prohibitive issue, but if you've been feeding kibble and canned food to your pet, and now they're 12 years old or they're 8 years old, and can you switch? Are they gonna?
Oh yeah, you can absolutely switch. I mean, it's never too late to improve nutrition. And again, like that's no different than a middle-aged person who's been eating poorly their entire life can still improve their health by changing their diet. And the nice thing when it comes to pets is because they are 100% reliant on what we feed them. Like, it's not a willpower issue with them. Like, they're not craving going to McDonald's or getting pizza or something. Like, they're getting whatever we give them. So it's this amazing thing where we have this degree of control that doesn't exist with most people. I mean, if I had somebody in my life that was literally cooking every meal for me that I ate and they were all perfectly balanced, that would be amazing.
Yeah.
But, I mean, not many of us have that luxury. Pretty much all of our pets have that luxury. You brought up something interesting, though, that it is sometimes a financial issue because just like with people, fresh whole foods are going to be more expensive than processed foods. And that's sort of a, kind of a financial calculus that people have to do. And that's something that I sit down and talk with people about all the time. And, the thing to remember is it's not an all or nothing thing. Like if you can feed your pet all properly balanced fresh food, that's amazing. If that's not logistically or financially possible, the more fresh food you can give them, the better. It's not like if every meal I eat isn't perfectly balanced fresh food, I should just throw it all out the window and eat nothing but junk food. That makes no sense. So it's just a function of get them as much fresh food as you can. If you can do all fresh food, that's amazing. But otherwise, do what's possible.
Yeah. And is it, I mean, I just hear of so many friends with pets, and like lymphoma seems to be a thing, or kidney failure seems to be a thing in cats and dogs. Is that because of all the processed food, you think, or what?
That's part of it. Yeah. There's a lot of reasons. I mean, there's genetics, there's environmental causes, there's it's quite a wide range of things. But there's no doubt in my mind that diet plays a part of it. It certainly does with us. So why would it be any different with an animal? And again, you think about, like, we know the effect that processed food has on people over time. It's very well documented in the scientific literature. Now, think about what would happen if every single meal somebody ate for their entire life was ultra-processed foods. I mean, and then we all scratch our heads about why these animals are getting sick and dying before we think they should.
Yeah. Oh, I know. It makes me sad.
It's a very fixable problem.
Yeah. Okay, good. So what is the diet that you recommend? I mean, is it per breed, or is it, I've heard, do dogs, like, is it bad to feed them the hamburger scraps from the dinner table or steak? Like,
yeah.
Someone asked that.
There's a lot to unpack there. So speaking broadly, what is ideal is a properly balanced, fresh, whole food diet. Exactly what's in that diet, ingredients-wise, it varies. Just like people, animals evolved eating a variety of food. So it's not like it has to be this forever. In fact, I normally recommend that people rotate through different ingredients over time to give the body different nutrients, because that's how the body works best. To your question about, like, table scraps and whatnot, this will be a very sort of perhaps unexpected comment coming from a veterinarian, but I think table scraps are great. Now, there's some caveats to that. It's important that we not feed our pets things that are, heavily spiced or seasoned, because it can cause tummy upset. There are certain food ingredients that you don't want to feed animals, things like onions, grapes, raisins, chocolate. These things they're toxic. Outside of that, I mean, if you're eating fresh, healthy food, there's no reason why you can't give some of that to your pet. For the sake of saying it, for purely behavioral reasons, it's a good idea to, whatever you're going to give them, put it in their bowl rather than feed them from the table, because otherwise you're going to have an incessant beggar for a pet. But that's more of a behavioral issue than a nutritional one.
Yeah.
Yeah.
And we can come back to some of the specific food questions, like,
sure.
What is a vegan diet? Like, some pet parents want to feed their pets what they eat. So what's a healthy vegan diet?
Let's talk about that. And so I'll preface this by saying I myself am vegan.
Oh, amazing.
So you can feed a dog vegan. Just like with a person, you have to be a bit more careful about balancing the diet. Dogs are what I would describe as sort of a carnivorous leaning omnivore. So they are well enough equipped to eat a plant-based diet that you can do it if it's being constructed carefully. There are recipes out there if you want to make something at home. There's not a whole lot from the standpoint of commercially made, fresh, whole food vegan diets out there. I'm sure there's some companies out there, but there's not a lot. But yeah, you can do it in a dog. Cats, it's a hard no.
Oh.
Cats are obligate carnivores. Feeding a cat vegan is basically, you are going to create a very sick animal. Wow. They're just not designed for that. As a colleague of mine once told me, you will never see a lion in the wild drag home an ear of corn. It's just not a thing that you will ever see. So cats, no go.
Wow.
Yeah.
That makes sense. It's almost like you'd think the opposite, but that's amazing. One thing that fascinated, before I dive into the specific questions from my pet owner followers out there, I'm sorry, pet parents, gosh.
You can use whatever term you want.
Okay.
I'm not insulted. It's fine.
Have you seen this phenomenon of, I think it's particularly in dogs, because there are tend to have been thought of as very compassionate and empathetic.
Sure.
I've heard these fascinating stories of where a dog has developed the same illness as a mirror to their human companion. Mm-hmm. Have you seen cases of that?
I have absolutely seen that happen. Whether or not one can directly connect those dots, I think is perhaps more of a philosophical question than a medical one. But yeah, it's interesting. Every now and again, I'll have to talk to somebody about, we just diagnosed your dog with XYZ, and they kind of give you this funny look, and they're like, I have the same thing. Wow. So it happens from time to time, and even setting that aside for a moment, there's no question that dogs are incredibly empathetic as far as their owners go, and cats are as well. It's a little bit less obvious, cats, because they're not quite so effusive emotionally speaking, but particularly dogs. I mean, they are pack animals by nature, so they're very in tune with those that they live with. So yeah, I mean, it's not surprising that those kinds of things come up.
Yeah, and I think I just want to mention this, that if your dog is presenting with some sort of symptomology or illness,
yeah,
and there's an intuition that's sparked in you, like, oh wait, I've been feeling something off, like, yeah, I would go get checked by a doctor, because there have been those phenomenons where the dog, cues you into getting checked,
yeah,
and then you have that something developing, and the dog was kind of like an angel messenger saying, you got to take care of yourself.
Sure. And I think it holds true with both human medicine and veterinary medicine. If something in your mind is telling you something's not right, go get it checked out.
Yeah.
You know what? The worst thing that happens is your doctor says you're fine, your veterinarian says he's fine, go home.
Yeah.
Yeah. But the earlier something gets diagnosed, the better the chances are it'll go well.
Totally. And I know, like, just the emotional, obviously, if an animal is in an environment of high anxiety or stress, or maybe there's like a family trauma happening, and
sure,
what's the mental health connection that you see between anxious animals and anxious parents?
Oh, it's a huge problem. I mean, we see a lot of people will come into the office with complaints about, like, behavioral complaints about the dog or the cat, that they're doing something that the owner doesn't like, and like the owner comes in and they're all spun up and stressed out, and like part of me is like, there's a little comedy here, because like they just don't see it. I'm like, do you not see what's happening here? And one of the things that I talk about a lot in the longevity books is and we've kind of touched on a lot of this, but really the effects of diet, exercise, and lifestyle on longevity. The science is quite clear. And to your point, when pets are living in a house where the people are stressed, then that is going to elevate their cortisol levels, and all of the same stuff that comes with it, including shortening of lifespan, will happen with them as well as us.
Yeah. So are you able to give the pet parent prescription for?
You can give them a little armchair counseling, yeah, and say maybe you need to go talk to somebody.
Yeah. That's amazing. So longevity for cats, longevity for dogs. What
yes.
are, like, you just kind of mentioned exercise, the basic fundamentals
yeah.
of,
mm-hmm.
of health and longevity. Give us some that maybe not so obvious, or what?
Sure. Yeah. So foundationally speaking, it's diet, exercise, and lifestyle, but it goes so much further than that. The next thing that I talk about in the books is veterinary care, and that's both from the perspective of how to be proactive with preventative care, but also how to really critically think about some things that are done very commonly in veterinary medicine that might not actually be doing your pet favors. So, for example, if and when they're spayed or neutered. How frequently they're vaccinated, whether or not they're getting regular medications, flea, tick, heartworm medication, antibiotics, anti-inflammatories. All these things have a place in medicine, but in many cases they are drastically overused and they're having negative impacts. So that's a thing. Then there's more longevity specific therapeutics. Certain supplements can be very, very beneficial. I go through and really list out all of the known hallmarks of aging in the book, and then go through supplements, pharmaceuticals, regenerative medicine, and discuss how all of these things touch on these various aspects of aging, so we can start to really kind of plan out how to slow that process so our pets are living longer and better lives.
Amazing. So the details are in the book.
The details are in the book, and for anybody that is at all familiar with longevity science for people, it will all look very, very familiar. It's really just a function of applying what we know for what's being done in people and animals. And, the irony is if you look at the science behind most of what's being done in longevity medicine for people, almost none of it is based on human clinical trials. There are none. It's based on preclinical data and animal trials. So, if an animal trial is good enough to treat humans for longevity, it surely should be good enough to treat animals for longevity.
Correct. Yeah, that makes sense. Okay, let's get into some of the specifics for the pet lovers out there. Okay. How do you make an animal lose weight when they show no interest in playing?
So, and I'll kind of keep coming back to the corollaries in people because it's almost always the same. So when you're looking to lose weight, honestly, like, exercise is important, but nobody really loses weight from exercise. It's a diet question. Mm-hmm. It's a calories question. So number one is how much they're eating. Number two, it's what they're eating. So going back to what we were talking about before, one of the things about, what most dogs, for example, are eating, they're eating kibble, which is obscenely high in carbohydrates, 60-70% carbs. Well, what would happen if most people ate a diet that was 60 or 70% carbs? So getting them on a fresh whole food diet is not only better for them in the whole, but all of a sudden you're increasing their protein and their fat intake and decreasing their carb intake. So just like with most people, if you have weight to lose and you cut back on carbs but maintain the same calories, you're losing weight. So that's step one, is just sort out their diet, make sure they're eating an appropriate amount of calories. And exercise is going to be part of it. Maybe they don't want to play ball. Take them out for a walk. Yeah. Go do something.
Yeah. And usually when you're eating better, you feel better, and then you have more energy and desire to do fun things.
And that's very much, that's such a thing with dogs. Like, take a really fat dog, for example. Like, no great wonder that they don't really want to go for a walk. It's hard for them. Get that dog to lose a bunch of weight, and you'll be shocked how much they want to go out and do stuff, because now it's fun.
Yeah.
Yeah. It's just like with us. It's just the hardest part is starting. Once you get a little momentum, it gets so much easier.
Totally.
Yeah.
Absolutely. And as you talk about that, I'm just thinking not only fat, but like the inflammation of the joints.
Oh, yeah.
Diet obviously is the foundation. Are there supplements that you are giving to, dogs? I don't know. I'm thinking of like a German Shepherd right now that have back hip issues.
Oh, yeah.
Like, is there supplements that you recommend for inflammation?
Sure. Joints? There are so many things. And, inflammation, osteoarthritis, that's such a common problem in veterinary medicine. But, for me, you look at herbs and supplements like boswellia, curcumin, hyaluronic acid, glucosamine. There's an herb called devil's claw, which can be very good for inflammation. There's so much stuff out there.
Yeah.
It's just ridiculous how much is out there. And, getting back to, what we were saying before about pharmaceuticals being overused, one of the most commonly prescribed pharmaceuticals in veterinary medicine are nonsteroidal anti-inflammatories to treat pets with arthritis. Understandable, nobody wants them to hurt, but there are potentially back-end side effects to these medications. So, in my office, it's not that I never prescribe those drugs, but I don't start with them. We start with diet, exercise, supplements like we were just talking about, maybe acupuncture, maybe some other therapeutics. And down the road, as they get older, if they're getting more painful, sure, we'll layer in some pharma if we need to, but it's just not the place you need to start.
Yeah, exactly. Unless it's like super acute and you need to bridge the amount of misery, which is exactly.
Everything has a place.
Again, like humans, because those NSAIDs are going to have side effects on their liver and kidney and stomach lining and all of that stuff.
Yeah.
So same with. So our philosophies are aligned on humans to animals. Do you need to vaccinate indoor cats? And if so, how often? Do we need to vaccinate dogs? If so, what vaccines are absolutely necessary? Is there a safe detox to do afterwards? I know that's a very broad question.
That's a 2-hour conversation in and of itself. But
Right.
let me see if I can give you a little bit of an overview. Cats. I do vaccinate kittens, even if they're going to be indoor cats, because I think it is important for them to have some protection. So let's say, so I'll vaccinate that kitten for things like feline distemper and probably give them a rabies vaccine. When they come in, say a year later, when on the calendar they would be due, if they're strictly indoors and never go outside, I'm never going to vaccinate that cat again. There's just no reason to. So they have no disease exposure.
Yeah.
Why would I continue to hit them with something that is intentionally stimulating their immune system if there's no risk of them getting exposed to anything? So that's cats. Dogs, clearly dogs going in and out is a little bit different. And I'm going to try and keep this short because we could go on. So just a couple vaccines to talk about. The distemper parvo vaccine for dogs. Generally speaking, once dogs are vaccinated properly as puppies, they will maintain immunity for years, if not a lifetime, regardless of what it says on the calendar. You can run what's called a vaccine titer in these dogs and check their antibody levels. So when they're due, you check their antibody levels instead of vaccinating them for something they don't need. So that's one thing. Rabies, rabies vaccines would actually do confer immunity for as long as distemper and parvo do. The hang up with rabies is that's a legal thing. Dogs legally have to be vaccinated for rabies, so that's a different conversation. Every other vaccine for dogs is on the table for discussion, and it very much depends on what their lifestyle is. If their lifestyle is such that they are not going to get exposed to disease X, then I am not going to vaccinate them for disease X. It just makes no sense. That's one of those things that happens in veterinary medicine all the time, is like, well, on the calendar it says they're due, so we should give it. And that's a problem. I mean, medicine should be personalized. Yeah. It should be individualized. I don't want to walk into my doctor's office and say, well, you're this age and you're a white male, so you get this.
Yeah.
That doesn't feel right.
Right. Well, that's what's happening. Yes.
Did I miss anything in that long list of questions?
Well, no, I think that was amazing.
Okay.
The detox. If you're going to give a dog or a cat a vaccine, and there's potential kind of lingering effects of that.
Sure.
What would you recommend to detox?
So I wouldn't say that every animal I vaccinate, I put on a detox protocol. And I think part of that is because we just don't vaccinate in the same way that a lot of pets get vaccinated. But I mean, you certainly can put animals on a detox program, whether it's, supplements that contain things like milk thistle, curcumin, SAMe, glutathione. When we say detox, mostly what we're really talking about are liver support supplements to help the body sort of flush out any kind of toxins. I was actually just talking to a friend of mine who works in another veterinary hospital, and she was telling me how frequently they see vaccine reactions. Like, they give a vaccine and like a half hour later, the animal's having an allergic reaction. And I sat there and I thought for a minute, I literally can't remember the last time I saw that happen in my office. And I think it's partially because of the vaccines that we choose, and partially because we don't give them that much, and partially because even if for whatever reason, for whatever medical reason, let's say this dog comes in and needs to get 3 vaccines, I'm not doing them in one day. We'll spread them out. You give anybody 3 vaccines in one day and they're probably not going to feel good. So again, it's just a question of like strategizing this out so you're minimizing the negative.
Can we take children to your office? No, kidding.
Yes, but I will not vaccinate them.
I'm kidding. I kid. Okay. So dental cleanings, again, like this is another fascinating thing.
Yep.
Because there's no dentists in the wild.
True.
But how necessary are dental cleanings for dogs? Are they still as necessary as they get older, or if they have other health conditions that make it more difficult?
Okay. So just to a comment that you just made, obviously there are no dentists in the wild. However, a lot of predators in the wild die because they have bad teeth.
Interesting.
They can't hunt anymore.
Wow.
Yeah. So like an old lion, that's actually a reason why some lions die when they get old. They can't hunt.
Ooh.
No teeth.
I mean, fun fact, sad facts, but fun
So
fact.
not every lion, but like that's a thing that happens.
Okay.
But that said, from the standpoint of health and longevity, there is no question that dental health plays a really big role. And that is an issue with animals, and part of it, and we kind of keep coming around to this. Part of it's diet. Part of it's what they eat, because what you eat affects what your oral microbiome is, and thus affects the degree of periodontal disease that you develop. So again, getting back to proper, evolutionarily appropriate fresh whole food diets, number one. Number two, ideally speaking, people should be doing dental care at home. The gold standard, without question, is brushing. I am not going to sit here and tell you that I brush my dog's teeth on the regular. I should, but I don't. But regular brushing is the best possible thing that you can do. There are all natural dental treats out there that you can use. There's a company that I work with called Ultimate Pet Nutrition. We created an all natural dental chew called Canine Fresh, which I like a lot. I think it works great. Dogs love it. So there's other things. So one of the things that sometimes gets me into a little bit of trouble with my professional peers is I will often recommend people feed their dog the occasional raw bone to chew on. That's one of those things that makes veterinarians' hair on fire.
Really? Why?
Because there's a concern about broken teeth. There's a concern about gastrointestinal obstruction. But the reality is if you're feeding... So a raw bone as opposed to something cooked, like something literally you would buy refrigerated or frozen, raw bones are softer, so the dogs can generally chew through them. They are digestible. And while they're chewing through them, it is scraping their teeth and helping keep their teeth clean. The bone has to be an appropriate size for the dog. I mean, you can't give a Chihuahua a cow femur.
Femur, yeah.
Yeah. So it has to be something that they can actually chew through. But I find that if you give a dog a raw bone like once a week or once every other week, they do incredibly well. Going beyond that, and clearly dental health is a big thing in my world. We do in my office, and this is another thing that sets veterinarians on edge. We do what are called non-anesthetic dental cleanings. So we have a very highly trained technician who will scale and polish dogs and cats' teeth while they are awake.
Wow.
Now, to be clear, this is part of a bigger picture preventative dental plan. It does not take the place of an anesthetic dental cleaning when that's necessary, and we do those as well. There are times when you really have to get in there, get deep under the gums, maybe extract a tooth. It happens, just like it happens with people. But again, this all kind of comes back to that whole personalized medicine thing of let's figure out what your pet needs and do what's best for them rather than they're 8 years old, they need a dental cleaning. That's just dumb.
And cats.
Yeah.
Same thing, brushing at home?
Absolute same thing with cats. And it might sound a little crazy to brush a cat's teeth. It's the kind of thing usually you have to kind of start them off early and get them used to it when they're small. If you have an 8-year-old cat and you come at them with a toothbrush, they're probably not going to be super excited about it. And then you just have to do other things. I mean, maybe it's dental chews. Maybe it's giving them like a chicken neck to crunch on if they will do such a thing. Maybe it's a non-anesthetic cleaning. Maybe they need a full anesthetic dental cleaning. It just depends on what they need.
Yeah. What are some ways to help an anxious dog overcome their anxiety and fear? And I guess I would throw in past trauma, maybe.
Sure, and that counts.
Yeah.
I have often thought that you take any dog or cat that came out of a shelter or off the street and tell me how they don't have some degree of past trauma or PTSD. They just do. They just do. So that's an issue that we have to deal with. Another issue, and again, this is a very big corollary with people, you have to look at the environment that they live in. Are they living in an environment that is conducive to low stress? Some of them are not, whether or not there's, kind of a lot of strife in the house, or they live in a very urban area where there's a lot of noise going on outside and the dog or the cat finds that disconcerting. Is that animal able to live a lifestyle that they are sort of biologically programmed to live? If you take a highly active, really intelligent dog, like a border collie, for example, and you put them in a one-bedroom condo where the owner works 12 hours a day, that dog's gonna go bonkers. And they're gonna be bouncing off the walls and highly stressed and eat your couch, and nobody's gonna be happy about it. You take that same dog and you get them out for a walk 3-4 hours a day, let them go run around and, be a dog, you're going to find they're incredibly calm and chill at home. So, and again, like I have little fluffy Shih Tzus at home. My little fluffy Shih Tzus do not want to go out for a 4-hour walk. They want to go do their thing back in the house. Yes. So it's very individual based on sort of the breed, genetics, age, health condition. So I think a lot of the whole anxiety issue with animals is really a function. We get back to that whole diet, exercise, lifestyle thing. Are we optimizing things for their body type, their genetics? Going beyond that, without question, there are animals that have behavioral issues. And in those cases, there's trainers, there's veterinary behaviorists, there are supplements that you can put these guys on. And if it kind of gets further down the pathway, there's meds. There's apps, just like with people. I mean, you can put dogs on meds, and in many cases, they do very well. But the one thing that I always want to stress to people is, just like with a person, you can't just put the dog on meds and walk away and think you're done. For people, when people take meds for anxiety or whatever it may be, that goes along with therapy. Yeah. So therapy for dogs is training. So what you need to do with dogs is you need to if they have structure, if they know what their day looks like, if they know what's coming, if they know who's in charge, if you give them a job and things to do, they're going to be much calmer and feel much better about things. Training plus meds or training plus supplements or training alone works great.
Let's talk a little bit about, you mentioned earlier spaying and neutering. What's your general philosophy there? Okay,
so for many, many years, the standard veterinary approach was spay or neuter the dog or cat before they're 6 months old. And the reason for that was spay or neuter them before they effectively go through puberty, and thus you avoid certain behavioral issues that you might not really want. Aggression, urinating in the house, mating behaviors, these sorts of things. So the hang up is that what we now know is that, and this is particularly true for dogs, particularly larger dogs that are spayed or neutered when they're that young frequently have a higher incidence of certain diseases when they get older. Arthritis, certain types of cancers, like osteosarcomas, hemangiosarcomas, things that are real bad if they get them. And it turns out that the dogs that are either spayed or neutered later or not at all have lower incidences of those kinds of problems. That doesn't mean that, okay, we're not spaying or neutering dogs anymore. Again, this is a whole individualized thing. So when it comes to, cats are a little bit of an easier thing, because unless you're like breeding cats, you really don't want an intact male or female cat in your house. From a behavioral perspective, it's not going to be a good time. So cats, we generally still spay and neuter early, like 6 months. Dogs, my general recommendation when it comes to dogs is for most dogs, I would like to wait until they're at least a year. For larger dogs or giant breed dogs, 1.5 years, 2 years, maybe even a little bit later, let them really get fully physically mature, get all of the physical benefits of the hormones before you take that away. And the other thing that I would say is, from a male dog perspective, physiologically speaking, there's really no necessity for those dogs to get neutered. Like, you do have to kind of monitor things behaviorally speaking, but with a female dog, you worry about them getting mammary cancer later if they're intact, and that's a concern. With male dogs, that's not an issue. There is a incidence of testicular tumors, but if it happens, you could neuter them later. If they get an enlarged prostate, you could neuter them and reverse it that way. But generally speaking, I mean, some of the oldest large breed dogs I've ever seen have been intact male dogs. There's something about them keeping those hormones that keeps them healthier, which, it's not shocking. That's how they were designed to be. But yeah, I mean, when you're not spaying or neutering dogs or doing it later, you do have to kind of monitor behavioral related stuff, particularly if you have a big dog. So you have to be a very responsible owner. Yeah. All of this comes with push and pull and responsibility.
Right. Yeah, because dog parks,
aggression, and the other thing is, if you have an intact male dog, even if they are in no way aggressive, they will sometimes be targeted by other dogs at the dog park because other dogs find them threatening and they will attack them.
Got it.
So that's an issue too.
Yeah. Interesting. Okay. Well, I mean, I don't think you can give advice here if they're not your patient, but a 12-and-a-half-year-old Labrador has been diagnosed with oral cancer, currently postponed chemo, and have them on homeopathy. Any suggestions on whether or not this is a good approach?
So obviously I can't give direct medical advice on something like that. However, I will say in general, oral cancer in dogs it's bad. It's aggressive and it progresses quickly. If I had a dog with an oral tumor, I probably would not go that way.
Okay.
I think that probably is not going to get done what needs to get done.
Got it.
Yeah.
Is it possible for pets and humans to transfer parasites back and forth from one another?
So the short answer to that question is yes. The long answer to that question is almost never. Most parasites are species specific. There are certain exceptions to that rule, but generally speaking, it's rare. Very rare, in fact.
Okay.
Yeah. I don't know if I've ever actually personally seen it.
Okay.
Yeah.
Well, then you've seen a lot. What other animals roll into your office besides dogs and cats?
I mean, these days, my office, it's mostly dogs and cats. We will occasionally see other things, birds, guinea pigs, rabbits, these sorts of things. Long time ago, when I owned a different practice, we used to see a lot of wildlife.
Wow.
So that was fun because all kinds of, people would bring all manner of things into the office.
Like what?
Anything from like raccoons, opossums, squirrels to hawks, herons, egrets, these sorts of things.
Wow.
So that was always kind of, you never know what you're going to get
Yeah.
when that kind of thing
That's
comes
cool.
in. Yeah.
That's awesome. Tear staining in a dog. Any way to stop it?
So, I mean, some of tear staining is nutritional. Diet change might help that. Some of it is just sort of a natural phenomena in the sense of there's a pigment in tears called porphyrins. So if you've ever seen like a white dog and they have like what almost looks like a rust brown kind of color there, that's the porphyrins in the tear staining. So that's not completely abnormal. Sometimes they have, if they have a blocked tear duct, so the tears aren't draining well, they do make supplements out there that can help with it as well. Also just like regular washing of that area to keep it clean. But to be clear, this is very much a non-medical issue. It's aesthetics.
Okay,
Yeah.
got it. All right. A lot of poop and pee questions.
Welcome to my world.
Any way to stop a cat that always pees or poops around the house when we're not home? I mean, training.
So yeah, I mean that's a behavior. That's a behavioral thing. So sometimes cats. I think of cats as like little tiny OCD people. So like everything has to be the same all the time. And I will tell cat owners, if you don't believe me, rearrange the furniture in your living room and see what happens. It's going to piss off your cat.
Wow.
They don't like change. So when people, for example, go on vacation and their regular person's gone, your cat's angry. And frequently when cats are angry, their manifestation of that is, I'm going to pee on your pillow or somewhere where I shouldn't.
Interesting.
So sometimes it's that. Sometimes if people have multiple cats in the house, sometimes it's a literal pissing contest between cats, and they're not necessarily getting along. So the behaviorists will say that you should have the number of litter boxes as you have cats plus one. So like think about it. If somebody has 4 cats, that means 5 litter boxes.
Oof.
That's a lot.
Yeah.
So that's one thing. Cleaning the litter boxes regularly. Making sure that the cats get a lot of environmental enrichment and they're happy and their lives are fulfilled, so to speak. I mean, cat training is difficult. They're cats. They do what they want to do. It's not like a dog. And in again, getting back to sort of getting down the road, there are sometimes meds that you can put cats on for these sorts of things. It's not my first, second, or even third choice, but like sometimes it gets to a point where it becomes a necessary discussion.
Okay. Dogs with floppy ears constantly get ear infections and have stinky ears. Anything to help prevent this?
So it's not necessarily all dogs with floppy ears. Certainly, like, for example, like Cocker Spaniels are notorious because they have like these big, heavy, floppy ears. So what happens is they'll get whether it's because they were swimming or is in the rain or they got a bath, but they got water in their ear, and then they have this big heavy thing, and the ear just never dries out. There's no circulation there. So it's almost like, if you look inside an ear like that with an otoscope, it's almost like if you've ever walked around all day in wet sneakers, you know what your feet look like afterwards? That's kind of what their ear starts to look like. Like the skin in there just falls apart. So part of it is keeping the ears clean and dry. That's a big part of it. Part of it is diet. A lot of times inflammation in the ears is set up by bad diets. So again, coming back to that fresh whole food diet thing. And then some dogs, quite frankly, are just prone. Sometimes it's a breed thing, like Cocker Spaniels. Sometimes it's the way their ear is put together. And in that case, sometimes you just have to be very preventative and proactive with things like periodic ear flushes. If your dog has very hairy ears that's trapping moisture in there, your veterinarian might need to periodically remove that hair. Chronic ear infections they're difficult to manage. Frequently they can be managed, but it takes a lot of work. Yeah.
Why do dogs eat poop? And is there anything that we can do to stop it?
There's a lot of reasons why dogs might eat poop, and I think a lot of people want to immediately hang that up on, there's something missing. They're like nutritionally deficient or something. And that is absolutely a thing for sure. For example, one time that I think you actually do see that is if you have an animal that is significantly anemic. So like they're iron deficient, you'll see them eat all kinds of things. They'll like lick asphalt. It's really weird.
Right.
But setting that aside, it's almost never a nutritional deficiency. More often than not, I think it's behavioral. Although I will say that, speaking in generalities, dogs love cat poo. They just do. I've often thought that if somebody wanted to make a medication that you could always get dogs to eat, you would make it cat poo flavored, because they would eat that. But that notwithstanding, it's frequently a behavioral thing. So it's a question of obviously discouraging them from doing that. If it's like happening in your yard, part of it's you need to be more diligent about picking stuff up in the yard. If it's a real problem, like you can put a basket muzzle on the dog, like when you take them out for a walk, so they can still breathe and drink and pant and do everything, but they can't pick anything up off the ground. So that's an option too.
Okay.
Yeah.
So I just had an idea. You should make dog toothpaste cat poop flavored.
Ooh, your dog's
Ultimate
gonna have
pet
some
nutrition.
Wow. Yeah, that's gonna be a hard sell.
Whatever it takes.
Yeah.
No. Do you guys do any sort of like energy healing at your whole integrated practice?
So I suppose that depends on what you mean by energy healing. I think whenever you're looking at things like acupuncture, chiropractic, whatnot, all of that is sort of putting energy into an animal in some fashion or another. I suspect you may be talking more about like Reiki and things like that. We've done it. I don't have somebody in the office that regularly does it. I'm in no way against it. It's just not something that we've really integrated into the office.
Yeah.
Yeah.
I love real stories. Do you have like an inspiring story or like a story? I feel like one of the struggles that I see animal lovers, pet parents struggle with is like, they've been diagnosed with this X disease.
Yep.
Outlook doesn't look good. Where's that balance between keeping them comfort and helping them transition to giving it all I got and spending another $8,000 or whatever it is? I mean, it's only for your intuition, but is there hopeful stories or like an inspiring story you could share?
Yeah, I mean, we could talk about those all day, and you bring up something interesting about the financial aspect of it, and that is, that's a real concern. There's no social safety net in veterinary medicine. Like if you don't have pet insurance, like you're paying, and don't get mad at your veterinarian if they can't cut you a break, because it's kind of a thin margin business we're in. Like, your veterinarian's not driving a solid gold car. But I am a big fan of pet insurance for that reason, because the one thing that I hate to see is to people make life and death decisions about their pet based on what they can afford. So like, for God's sakes, get pet insurance. That said, we could talk about those stories all day. I had somebody in my office just a couple days ago with an older German Shepherd that I first saw, I don't know, a year and a half ago or so. It's a big, even for shepherds, it's a big shepherd. It's like a 90, 100-pound shepherd. The dog's arthritic. The dog's got bad skin. And he came to me kind of as a last resort, thinking like, this is the end of the road. My dog's on his way out. And we sat down and we had a conversation, and we worked on his diet, and we got him on some supplements for arthritis, and we did some things for his skin. And here we are a year and a half later. I just saw him the other day, and he's like, you gave my dog a new lease on life. I thought it was the end. And he's doing great. And I've heard that so many times. And you want to talk about something that'll get you out of bed in the morning is that. Yeah. Whether it is, the animal that was diagnosed with cancer, and the oncologist said, I give them 4 months, and 2 years later they're still around. And everybody's kind of scratching their head about what just happened, or literally dogs that get carried in and walk out. Mm-hmm. We had a dog in my office, still comes in, that had blown a disc, and the dog was completely paralyzed in the back end, and had been for 4 to 6 months.
Oh my gosh.
And I sat down with these people and I said, look, your dog's not going to walk again. And I made them cry, and it was very sad, but I'm trying to be realistic and honest. But I said, look, let's start some acupuncture. Let's get him in for physical therapy. Let's see what happens. That dog is walking.
Wow. That
dog made a liar out of me. And I give all the credit to my rehab staff that made that happen, because it was their hands that did it. But it's amazing what can happen when you give these animals a chance, particularly because, with dogs and cats, there's no self-pity. There's no why me when it comes to animals. They just want to get better. And you give them half a chance, and if they have even any scrap of biologic and physiologic ability to do it, they'll find a way. Yeah.
Oh. So that brings us back to you. We started what
okay.
Little boy Gary.
Yeah.
Always loved animals.
Sure.
Dad, deathly allergic to dogs. Wasn't able to have one.
Yeah.
Now I'm just sitting here listening, and so many parallels about you and, human doctors.
Yeah.
Or doctors of humans.
Yeah.
How do you navigate that, just that your conscience, and you don't want to give people false hope.
No, of course not.
But at the same time, you don't want to, rip the rug out from under them. How do you balance that? How do you even how does your heart handle loss, and how do you maintain that balance of keeping yourself emotionally healthy? Maintaining
one's sanity.
Yeah.
Yeah. That's a lot. I think on the one hand, I feel on a personal level, I feel very good about what we're able to offer these animals. And so that part of it's really nice. I know that we're offering a lot more than most people are going to be able to get in most other sort of veterinary circles. So, being able to give people some hope, some chance at things getting better, and clearly not everything gets better. And our patients die, it happens. But to me, and I think most veterinarians would agree with this, at the end of the day, your goal is to sort of maintain quality of life first. Quantity of life comes second. Nobody wants to live to be 110 years old if you were miserable for the last 40 years of your life.
Right.
So a lot of this is, how do we maintain quality of life? To your question of expectations, it's really a function of sitting down and having a very transparent conversation with people. This is what your pet has. This is what we're up against. We can try this, this, and this, and we're going to hope to get an outcome here. But, as I often tell people, there are no guarantees in medicine. That's the only guarantee, is there's no guaranteed outcome. And we'll do our best. And that's all anyone can do. And at the end of the day, when it does get to that point, when it's time to say goodbye, to me, as sad as that is, it is also such an incredible blessing to be able to do that. I look at it as it's the last best favor we can do for these family members. You know, I mean, frankly, it's the favor that you and I will probably not get. You know, so if we can give them a soft landing and not let them suffer until the end, like, there's no way that I'm not going to feel good about that. It's going to make me sad, and I don't like doing it. But at the same time, the alternative is way worse.
Oh, we're both crying over here. But it is. It's having that ability to connect and soft landing. Thank you for sharing that.
You're welcome.
And thank you for the work you're doing, because truly, you know, just in every aspect of society, I think we need, you know, to supplement with holistic, or actually kind of fundamental, take the holistic route, and then be able to tap into the data and the knowledge and the technologies that modern life and conventional medicine gives us.
Totally agree.
So how do people find you? Where can people find your books and your practice and everything?
Sure. So the new books, Longevity for Dogs and Longevity for Cats, and then my first book, The Ultimate Pet Health Guide, which is a really comprehensive look at integrative medicine for dogs and cats. They're all on Amazon, easy to find. drgaryrichter.com, @petexpert.com. I'm on Instagram. I'm in all the places apparently one is supposed to be.
Yeah.
I am no social media guru, but there's people that help me. So that's a good thing. I have all natural pet foods, freeze-dried raw food, and supplements at ultimatepetnutrition.com. So that's a place where people can get, you know, if you're looking for an easy way to get your dog or your cat on a fresh whole food diet, that's a super easy way to do it. So that's available. And if you happen to live in California and you have a pet that needs something, my office website is holisticvetcare.com. And one great little sideline is as of January 1st of this year, veterinarians in California are now allowed to do telemedicine consults.
Oh, amazing.
It's a brand new thing. So the person has to live in California. It has to be within the state. But I no longer actually have to physically see the pet in order to treat them.
Oh, my God.
So, in fact, I did my very first one the other day, somebody that lives in Malibu. So that was great. So, yeah, I mean, if somebody lives in L.A. or Bakersfield or whatever, they can still set up an appointment in my office.
That's awesome.
Yeah.
Amazing. So more people can reach you.
Yes.
It's great, and your expertise and your heart. So thank you so much for coming on the Heal podcast, and just best of luck with all those animals you're saving out there.
You bet. Thanks for having me.
And pet parents.
And pet parents.
You're saving them too.
You bet.
Thank you for listening to the Heal podcast. Be sure to tune in every Thursday for more empowering wisdom and inspiring healing stories. And make sure you hit the follow button on Apple, Spotify, or wherever you listen to podcasts so you don't miss that one episode that holds the answer you've been searching for. And please rate and review us so that we can grow and reach more people. Thanks so much, and be well.